today I'm going to talk about standards, maintaining standards in healthcare. Anytime standards are mentioned, oh, these days standards are falling. Where are they falling from? Standards are falling. Who measures standards? And what are the current standards? And which ones are falling? So today we're going to look at how the standards are, whether they are falling or they're actually, or why are we even talking about standards today? So my objective is to make sure that, to remind ourselves as colleagues about our pledge to serve and not to cause harm. When we're going through the Nurses Pledge, I realize that most of my issues are inside the Nurses Pledge. And as we move along, we see how they are captured in the Nurses Pledge. All the things we set in the pledge, sometimes we deviate. We don't go by our pledge. We do our own things. So today we remind ourselves that let's go back to what we are supposed to do. We want to ensure quality. We want to ensure quality, safety, and ethical practices. There are times you go to a hospital and some people do something, oh, this is unethical behavior. What is unethical behavior? We want to improve professional standards in our health facilities. I'd assume that all of you are coming from facilities. We are into all clinical care, isn't it? Is there anybody from the training college here? Teaching institutions? I don't think we'll have them. So all of us are going to be talking hospital, hospital, and hospital. To look at the importance of professional standards, what they are, regulatory bodies, components of professional standards, benefits of professional standards, cases of breach of professional standards, the standard that we are supposed to practice by. If we break them, what happens? Sometimes we are taken to court, and then only a few hospitals in Ghana have not gone to court before. Sometimes if they don't go to court, then they will settle it the gentleman way after court, so that the public will not hear about your issues. So we'll look at a few cases that we have taken us to court. We'll look at challenges of professional standards, strategies to overcome them or to improve professional standards, then the way forward. We are talking about standards because the public is not happy with the way we serve them. Am I right? Yeah, there are a lot of complaints about how services are not good, particularly in public health facilities. You go to a government hospital and sometimes the reception alone is something else. You are not welcome. Your sickness starts getting worse at the OPD before you get to the ward. So that is why I want to talk about standards. The second issue is that there are a lot of cases, legal, medical, legal issues in most of our hospitals. The better we'll talk about them, then we can prevent them. If you don't talk, as I said initially, there's no hospital that hasn't gotten an issue of medical, legal issue, or sometimes they just forgive you and say, oh, they're from Miami. But it's not all the time. Some people say that others will go there full length and get their 5 billion cedis from your hospital. Even if you want, they will sell your pickups and go and pay for the compensation. So let's take note. So by definition, we're saying that professional standards define the expected behavior and level of competence required of nurses and other health professionals, such as doctors, pharmacists, nutritionists, laboratory scientists, radiographers, and the rest. So everybody that works in a hospital has some standards he's supposed to go by. That's one definition from these three people. Another one says, it defines the standards of professional practice and focus on the individual conduct. Conduct means what? Our behavior. Or attitude. Attitude is what? Everything. If the attitude is wrong, you will never get results. If your attitude is not positive, forget it. They said attitude is like what? A flat tire. You can never move the car. So once the attitude is negative, no matter how you motivate the person, things will never work out for you. Then the other aspect is what? Education. Education. What do we get from education? We get knowledge. The third one says competence. Competence refers to our what? Our skills. When we do all the plenty learning in the classroom, then we go to the ward, we have to apply that to the ward, and that brings us to skills. It is the responsibility of regulatory bodies such as the Nurses and Midwives Council, Medical and Dental Council, Allied Professionals Council, Pharmacy Council to establish and monitor standards. So every professional in the hospital is at least regulated by a body. What I mentioned, the doctors are there, the pharmacists are there, allied health professionals, who are they? The lab people, nutritionists. Of late, I hear they also regulate the records people, those who work on our records. Gone are the days, the stubborn staff, they'll push them to records. Meanwhile, they can also mess up the OPD or mess up the information you are producing. Do you understand that? So don't take the drunkard to the OPD as leaders here. Most of you are leaders, isn't it? Incoming in charges, or some of you are already in charges. So please, when you go back, advise our big men, the medicine. Don't send the drunkard there or the one who comes to work late. Let's send everybody. I mean, let's mix the staff up so that they can also serve as a check. So as I said, professional standards are a set of guidelines and principles that we are supposed to follow. They are established by bodies, health training institutions, and all those things. They could also be seen as code of what? Ethics, clinical guidelines, and standards, accreditation standards. We have code of ethics, code of conduct for midwives, code of conduct for what? General nurses, isn't it? Do we read them? We don't read. When I became nurse manager, I went to the Nurses and Midwives Council and bought all the categories. It came to the wards and distributed. Public health, this is your copy. Midwife, this is your copy. But if I go there today, I won't find them. They've gathered dust all over along the line. They've gathered dust. Our people are not reading them. But at least that book is not long. It's within a day you can finish. I don't think it's even up to 200 pages. No. It is around 60, less than 100 pages. But we don't read. That's one of our biggest challenges. Nurses don't read. If I ask what is today's daily graphic, what was the headline? I may ask some. Yeah, today's daily graphic, what is the headline? No one knows. You don't see some. But watch TV news or go online, my joy online and all those things, Ghana Web. We don't do it. And that's one of our biggest challenges. Once you don't read, those who read what always cheat you. Or they want to topple it over you. So the regulatory bodies I'm talking about, this is a law that was passed by Parliament in 2013, and that law says that every professional group should be regulated. So the doctors have the Dental and Medical Council, Nurses and Midwives Council, Pharmacy Council, the Allied Health, and all those things. And what is their duty? Those regulatory bodies are supposed to ensure that they govern your education. What are the requirements before you can go to NTC? What are the requirements before you can go to medical school? They check that. They check how you're supposed to be licensed. If you finish school and you don't have a license, you cannot work. You understand that? You cannot work in Ghana, you can also work outside. Then they also define the standards. And those standards, they come in different forms. They also check that your practice should be within the law. Anytime doctors misbehave, sometimes they are taken to a medical and dental council, isn't it? When nurses also misbehave, what happens? The Nurses and Midwives Council, and even they will add the association. Come, one of your members have misbehaved. Let's sit down and see whether the person went according to the rules or not. So that is how it's supposed to be. So that our behavior is what? Controlled or is monitored. Yeah, so we belong here, Nurses and Midwives Council. And I picked this from their website. They said the law says that they are to secure in the public interest the highest standard of training. We're supposed to have the highest standard of training. Are we having that? Hey, the room is quiet though. Are we having that? Yes, we are supposed to have the highest. Even if you're not having, but we're supposed to have. That is what the law says. So please, when the students come to the ward, let's ensure that they get the best from us, so that we can have the highest level of training. And practice of nursing and midwifery, we're supposed to have the highest training, and the training should reflect in what? In practice at the world level. They are to ensure the availability of qualified nursing and midwifery professionals who would give competent, safe, prompt, and efficient service for client delight. So that is why Nurses and Midwives Council is there. This is what they're supposed to be doing. But sometimes we don't get the highest, and sometimes we don't get the availability of what? Qualified nurses. The qualified nurses are doing what? Flying outside, and they're not flying inside. So we are all ambassadors. Let's make sure we have the best within the country. So let's look at some components of professional standards. The first one is ethical conduct. What is ethical conduct? Ethical conduct. This has to do with acting according to the rules. Make sure the right things are done at the right time. If you do the right thing at the wrong place, it will not be considered ethical conduct. Or you do the right thing at the wrong time. Particularly in our practice, there are certain things to do is right anyway, but you shouldn't have been done at this time. The care should have come very early, or it should have been prompt. But you don't wait. When the patient is almost going, then you now bring the oxygen. Only for the person to pass away and say, oh, I also brought oxygen. It didn't come at the right time. Do you understand that? Or when you were supposed to set a line, you were waiting for the doctor to come and give order before you set a line. Now dehydration has taken the patient's life away. So please, let's take note. Clinical competence, that one has to deal with our skills. and all those things. Communication skills, and I will explain them in detail as we move along. So I said patient confidentiality and privacy is part of our clinical, our ethical conduct. Some of us are okrumas. We talk too much. People diagnosis, we discuss them in Texas. Trotro for those who are in Accra. Because we don't have trotros here. We are big people who don't enter trotro. No. And people will not do that at all. So we discuss people diagnosis, lab reports that are supposed to be confidential. They are flying all over the place. That is all right. We do a lot of things that are not professional or that are not supposed to be done. So please, let's watch it. The second one is informed consent. These days, we think the patient is just a robot. Madam, turn your buttocks and I'll give you an injection. That is all right. Or there are certain things you're going to do that has implications on the patient's future or even the present. You're supposed to talk to them. Let them give you their support or let them give you their cooperation. Oh, I will do it. You don't tell them and just go ahead. It's a case, a woman was brought in unconscious with ruptured ectopic. No, ruptured, the uterus was ruptured. So what they will do is total, isn't it? So they remove everything and they didn't tell the woman anything. After a few years, he was looking for pregnancy and he wasn't getting. So he went to hospital to hospital, and sometimes we rush things. He had been to so many places. Finally, they did a scan and realized that there was no even uterus in the first place. You can't get pregnant when you don't have a uterus. Then they asked her where they did the operation. They mentioned the place. He went there, and the doctor who actually did the operation is not even on pension. You see the harm you have caused to the person. He didn't tell her that because of how things were, you have to take off your uterus, and you will not be able to give birth again. I mean, you did it for the good purpose, because if you don't do that, you'll not save the life of the woman. But you should have informed her afterwards that it's not possible for you to give birth in the future. There's also another one called non-malfeasance and beneficence. That is cause no harm. Just like what is in our pledge. Do good to everybody. At least when people come to you, the minimum you can do for them, please do it. Sometimes people come to us and would rather raise their BP or put a lot of fear into them. The next time they don't even want to come. You go to the ANC, attendance, 300 per month. You go to maternity deliveries, 18. Why? See that you are laughing. ANC attendance, 300 per month. Deliveries, less than 50. What is happening? They are going elsewhere. They are going to another place. They have not traveled. They haven't traveled. They are still in Cape Coast. They are going elsewhere. So please, let's look at the way we handle our patients at wherever we find ourselves. Professional integrity and accountability. We need to be trusted. Some of us, the patients don't even trust us. We are not honest. We like cutting corners. Leadership by example. If the patient doesn't trust you, when they come, they won't tell you what is wrong with them. But there are certain nitty-gritty issues that they need to tell you so that at least you can help them. Some of the people who come to the hospital, they don't need medication. No. They need to talk to somebody about issues at home. That's all. Particularly this time that things are very difficult. The man comes, he's lying at the medical ward. All the labs are negative. Still, he's not well. What are the issues? The financial, you cannot solve them, but psychological one, why not? We can do. Is that not it? You can talk to somebody and say, that's not the end of the world. We have young nurses committing suicide. Why? We are not engaging with them. We need to talk to them, talk to our colleagues. When you see a nurse talking alone, there's a problem. Find out. Because see, what is the problem? Financial problem. So encourage him. Encourage Kwesi that all is not lost. There are other things that Kwesi can do to help himself. Or if it's a lady, you can find out. If it's a broken heart, tell her, don't worry. There are better men out there. Don't mind that one that are just snub you. He doesn't know what he's missing. You are more prepared for somebody else. And somebody is going to cherish you. So let's talk well and let's be trustworthy. Clinical competence. I've spoken a lot about this. And this has to, we should have to practice based on evidence. You know, some time ago, we used to resort to do dressing. Yeah, now we've stopped. They said research says we shouldn't do that. Is that not it? Yeah. Hot care, we used to use spirit. Now it's a thing of the past. We're now using what? Chlorhexidine. And that's what the midwives are doing now. So it was based on what? Research. Me and you can do some. Okay? Look around. Maybe there are some patients, anytime they come, or there's a ward, every time patients come there are what? Bed sores. What is causing that? Or there are some particular nurses, anytime they're on duty, a patient goes. And you understand? Or you realize that in your hospital, all the deaths are recorded in the night. It's possible that 9 nurses are always in coma. They sleep throughout. Then your patients die in the night. Or you find out why is it that people are always dying 3 a.m. or 3 p.m. Find out who are those who are on duty. And that's a form of research that we can all do to solve problems. It doesn't have to be a very big one at university. No, it's not all of us that can go to university. It's not all of us that can be lecturers. Or you are, shine your small corner, and people appreciate you. Do you understand that? Yeah. So we are supposed to renew our pens all the time, do CPDs before we can renew our pen. We need to adhere to. Sorry. We need to adhere to clinical guidelines and protocols that are given to us by the Nurses and Midwives Council, the Ghana Health Service, and Ministry of Health. For everything that we are doing, there are always protocols. Is that not it? If you go to ANC, there are a lot of them. TB. There's no activity we do in the hospital that has no protocol or guideline. You're supposed to follow it. Or sometimes we put those things aside. I say, oh, yeah. That is the slogan. Oh, this one, you've done that for 10 years. Nothing happened. BBNC. So we'll continue with our old ways. Please. The protocols are things that have been taught through. Guidelines are things that people have studied. It's tested everywhere, and they think that it works. That is why they have brought it to you. So please, let's follow them. Peer review. In Central Region here, it's always like a football match. A heavy competition among the facilities. But it's good. Last year, a lady came to my place and told me that, oh, Mr. Tamak, the way you use soap dish and put it there is not the best. Sometimes it gathers water and bacteria and all those can grow on it. Why don't you continue to use the bottles? And I've adopted the container one, the one you press with your hand. And you see that is good. All this year, I didn't know this. Or I knew, but it didn't click. But somebody tells you anything, no. So when you go for peer reviews, look at the best practices that other facilities are having. And go back to your place and implement them. There are some of the things you don't need money to do it, like what he told me. You just switching 1 or 2 things and that's all. This is a Midwives Council came to my place and said, oh, the way things are organized in the theater, in the maternity, if we put them this way, it will work. Then when we put them, they will realize that we even have more space than we're complaining. So some of the things, some money. Every time we say, oh, and management hasn't given us the money. Look inside your own corners. Sometimes you don't need money to do better things or do good things in your hospitals. Are you with me? Communication. We should give clear and compassionate or positive communication with our patients. I was talking about the OPD nurses. Not everybody that can work at the OPD or the emergency. Take people who have the heart, people who can tolerate a lot of nonsense. Because when patients come, they have a lot of nonsense to tell you. Get people who have that heart to tolerate those things. You can send those who are to a medical ward. By the time the patient gets to a medical ward or a surgical ward, he has cooled down. They giving the injections at the OPD, and at the emergency, the person is calm. He can't disturb at the ward again. But there are some people, by their nature, they can't work at the OPD. The person is very temperamental. Don't do it. Get people who are well-mannered to be at the OPD or at the emergency. Bad news. It's not everybody that can break bad news. Sometimes, in announcing a funeral, you do what? You create another funeral. Yeah. Or somebody has come to deliver, the baby is gone. Yeah, you need somebody who talks to the husband, even particularly the woman. They are normally the most affected. The husband too is the same. Get somebody who has that heart or who knows what to do. A counselor. If the counselor is not there, get a senior person. Sometimes the doctors run away from these things. It's me and you who have to do it. Is that not it? They run away from it. Ideally, they should do it. But they run away. And breaking the news. It's a very important thing we need to take note of. You need to know when to do it. If you call the person says, I'm somewhere, please let the person come and you sit with the person. Ask him or her, how related are you to this person? And whilst you're talking, your hand is at the back of the person. Then you're massaging the person while drawing the person closer to the issues. Very sorry yesterday when they brought your husband, or very sorry yesterday in the night, you couldn't make it. Then you are still with the person, you should hold him or her. Gradually, he will come to accept it. Allow the person to cry, it's normal. It's a form of therapy. Okay? Sometimes the venue where you are doing the disclosure is also very important. If you know, the environment should be fine, and should have maybe some emergency things around at the emergency or some place, something close. In case of any collapse, you can easily help the person out. Are we okay? So our talking or what we do in terms of communication is very, very important. Meanwhile, we're all interested in what? The patient. Public health nurse and disease control, they don't meet. So if you don't meet her, how will you prevent diseases? And that means the two of you are even problem in the hospital. You need to be solved. We have these things in our hospital. Lab man and the nurses in the ward, they don't meet. One day when you need blood to save your husband, that same lab man you don't talk to, you'll be the one who has to give you the blood. Can we change our attitude towards each other? Yeah, it's very important. All this, we need them all. Never say anybody in the hospital is not important. Even the laborer who cleans the floor. Imagine the laborers go on strike, or the cleaners, when they go on strike, the work cannot be done. The place will smell so much. Even you yourself get there, you get the infection before you get back home. So please, the fighting that we normally do is not healthy. It doesn't help anybody. We need to make friends with all these people that I've mentioned here, so that one day when you're in trouble, they can easily come to your aid. Accurate and timely documentation. Sometimes forgetfulness. We get too busy at the ward. You do so much, but you don't write anything. At the end of the day, they say if it's not documented, it's what? It's not done. So please, let's take note of those things. Cultural competence in patients' interactions, respect traditions. Give people their titles. If you're a Christian, that doesn't mean you see a Muslim in a ward, frown your face. No. The Muslim is also a human being. The Jehovah's Witness who says, I won't take blood, respect that. If you want to convince him or want to talk more to the person, take him or her to a corner and say, oh, my sister, I think if you don't take this blood, this and this may happen. Sometimes behind the scenes, things work out. You discuss, you say, oh, don't worry, you can do it in the night around 10 o'clock. Blood is supposed to take 4 hours. I'll make it 2 hours or 2.5. As an answer. It's a compromise. That is it. Are we okay? I'm not going against people's religions. I'm not preaching that you should, no, please. But it's a compromise we've reached. We want to achieve something. We are all medics. You know what happens if you don't get blood. Yeah? So sometimes you can reach a compromise without disturbing public peace. So please, let's take note of those things. Yeah, as I said, give people their titles and orders. It's very important. Everybody is a big man or a big woman in his or her house. So when you come to the hospital because of sickness, then you are treating the person anyhow. Oh. And the person feels worthless. Even when you ask the person a question, you won't say it. He's afraid. You know, health workers, people fear us. Do you know that? Yeah, generally the population in Ghana, they fear us because of the way sometimes we react towards them. When they get to the hospital, then everything is lost. You ask them, open your bottles or open your dress, and they are willing to do it. Everything you say, no, they won't argue. Everything you say, health workers, they fear so much. Let's not abuse it. Let's do things right. If you want them to see the bottle, you want to give the injection, say, please, can I give you an injection? This injection cannot be given through the vein. It has to be on the bottle. That is why I want to do it. If the person says, please, I want a male nurse or a female nurse to do it, I obey that. It's important. Respect their opinions. Continuous learning. I think I've spoken about that one. Quality participates in development. This program, I've spoken about that. If we do all this, we'll be what? We'll be up to date with the latest research and technological advancement and care. So let's see some benefits of maintaining standards. If you go by the standard, we are going to have, it will provide consistency across practice settings. That means what somebody is doing at Cape Coast Teaching Hospital is the same thing somebody is also doing at what? Tamale Teaching Hospital or Hope Teaching Hospital. Because you are going by what? The guidelines or the protocols. They provide a common understanding of the parameters in which nurses work or practice. That is it. The protocol will state out what they are supposed to do. If somebody comes with malaria, what are you supposed to do? Over the years, we used to just diagnose malaria without testing. These days, they insist you should do a test. Test, treat, and what? And track or something. I don't know about it. It's like 3 something. You're supposed to test, treat, and track or something like that. I'm not so sure about, but that is what the protocol says. So you should go by that. They serve to describe the essential elements of the professional practice. So your professional practice, the guidelines will show you what you're supposed to do, or the standards will show you what you're supposed to do as a professional nurse. Adherence to standards will reduce medical legal issues. If you don't go by the standards, every day you are taken to court. And sometimes it's so easy. We have very hungry lawyers in Ghana now. The economy is not good. So please don't make a mistake. If they take you there, your hospital can even pay. Sometimes they'll sue you and add the hospital because the hospital is bigger than you, the individual who has caused the problem. So that apart from taking money from you, they take some from the hospital too. So let's take note of those things. You provide a reference point that can be used to evaluate accuracy and professional practice. Improves, if you go by the standard, we improve quality of care given to our clients, and also reduce the cost of healthcare to the individual and to the nation. A patient comes to the ward. If you go by the standards, malaria treatment within 3 days, the patient should go home. But you didn't go by the standard before the person has what? Typhoid. Or the patient came with what? Pneumonia, before I realized bed sores. You're supposed to lie in your ward for 5 days and take what? Amoxicillin or aspirin. And because you are not going by the rules or doing your own things before the person start developing what? Bed sores. But ideally, should I come to your hospital with pneumonia and go home with bed sores? Oh. Or CVA. Sometimes it's so bad. But before the person has bed sores that will even kill the person than the CVA that he brought. The paralysis has occurred anyway, but let's manage it well. Turn the person very often so that the bed sores don't come. Because once you develop the bed sores, before like infection, septicemia, and all manner of things will set in, that can take the old man or the old lady away untimely. Okay, so we'll look at some cases of breach of standards, certain things that didn't go well, and how the law determined those cases. So there was a case in Kumasi, the Amina case. I think you heard about it. A Muslim woman went there and gave birth. I think the following day or the third day, he went there and they said the baby could not be found. You can imagine that. If that is your sister or you're the one, the husband, how will you take that? I think that matter, the Nurses Midwives Council went into it. There was a committee that handled the case, but I don't know about the details. What finally happened, I'm sure there was some punishment and all those things. Yeah, some of you know about it. There was also a case at Obuasi, the gold mining people, their hospital. There was also another one at Apam Catholic Hospital. I'll give you the details. And there was also the GRNMA government hospital case, the recent one. I won't talk about it, just to also hear how you react to it. I won't talk about it. It's still in the process. A committee has been set up to work on it. Whatever report the committee will bring, we'll accept it. But me and you, professionally, we know what the issues are. You understand that? Okay. What did they say? Okay, so Rich Hospital, about 5 years ago, there was a woman there that died because of wrong medication. I think you heard about it. Hey, we don't read news, so, or we don't listen to the radio too. So they gave her wrong medication. I think it was at the maternity. Yeah, by the time, I think it was even a doctor or something like that. Other doctor and a nurse, they messed up the woman and the woman died. These are some of the things I'm talking about. Callable for them every day. For them every day. Chamagena Hospital. They will look at some of the lessons learned from and the compensations we had to pay for some of those things. So the first case is Asafo versus Catholic Hospital of Apam. This is a case where a man or a woman took a 6-week-old baby who went on admission at Apam Catholic Hospital. Then after a few days, the baby could not be traced. Yeah, it happens in some of our places. The baby could not be traced, so the family decided to sue the hospital. So when they went to court, the judge said, no, a baby that is just less than 1 month or a 1-month-old baby cannot get missing like that. You understand? Something fishy happened. Where is the baby? This thing happened in our facilities, particularly in the labor ward. Somebody has given birth. Tell the woman the sex of the baby. Maybe they've done scan and other things. They knew it was going to be what? A baby girl. Then all of a sudden the maternity say, oh, it's a boy. Hey, sometimes we can do things so. So these things, they do happen. It's not the best. If you are caught, the consequences are there. So let's take note. So the judge said they cannot put material things or monetary terms on human life. But I'm sure they pay some level of compensation. But they just said they cannot put, how much can you buy a human being? You can't buy a human being. Human life is human life. You can't buy a human being. That is why in some cultures, dowry is just nothing. They take a token and let the woman go. After all, you are releasing a problem to a man to go and handle. The feeding of that woman or that human being is going to be taken by somebody else, so don't add more burden by giving so many things, requests and all those things. The second case, Jan versus Ashanti Gulf Field Corporation. So that's the one to a man or a woman took a 1-year-old son to a company's hospital. And the senior nurse, who believed that the child's presenting history was subjective for malaria, decided to give chloroquine. That's those days. You have some chloroquine nurses here. Those of you who saw chloroquine, we stopped chloroquine around 2005, 2010, thereabout. But chloroquine was a drug of choice for all kinds of malaria, whether complicated or uncomplicated. That was the drug we were using. And it was also a very dangerous drug. If a child had anemia and you don't know, the child goes. And you give the IM, the child can just die on your hands. So those days, it was quite something. So this is the case. The child was brought. The doctor wasn't there. But the nurse at the OPD decided that, oh, let me give the chloroquine. He gave the chloroquine and the child got paralyzed. The child got paralyzed. The chloroquine was given without the doctor's orders. And the child got paralyzed. So they took this case to court too. And the court said that the first one ruled in favor of the client or the plaintiff. And they had to appeal. They have to appeal the case. And the court said that, under normal circumstances, all things being well, if a child came with this sort of symptoms, what they would suspect is what? The malaria, and the chloroquine was the right drug to give. However, you gave the drug without a doctor's order. That means you were acting outside what? Your scope. You understand that? Yeah, sometimes we have dilemmas here and there. Is it right? Am I to do or not to do? So the appeal actually saved the nurse. But the first case, on the first one, the nurse was supposed to be liable. But the second one, the judges said no. Under normal circumstances, any reasonable person, medical person, will give what? The chloroquine injection to save the life of the child. However, the nurse acted outside her scope. So these are lessons we should all learn and take note. The third case, Sumi versus Tema General Hospital. A 36-year-old pregnant woman was rushed to the hospital with an antepartum hemorrhage. I think you know that. The doctor on duty had finished earlier than expected. That means the doctor closed at 4 a.m. The locum doctor in Accra. He closed at 4 a.m. And the person who was supposed to come in the morning came at 10 o'clock. Locum, baby. It came at 10 o'clock. And this one was pouring. The nurses couldn't do anything. Finally, the woman died, and the baby also died. I imagine the double trouble you have caused to the family. You can imagine the double trouble you have caused the family. They couldn't save the unborn child, and the mother too, or didn't also survive. So it was also taken to court. Let me mention that they actually did the operation anyway. They did the operation, but they couldn't save the life of the mother, and they couldn't save the baby. Because there are times when the vital signs are bad, they are bad. You can't revive them. So let's take note and always act promptly. If you have to take steps, let's do it before it gets bad. So it was held that the failure of a public hospital to ensure that an emergency cesarean section operation was carried out on a patient, thus leading to her death, constituted a violation of her human right to life. So there we are talking about what? Negligence, abuse of official time. You're supposed to close at what time? 8 o'clock in the morning. Somebody should take over from you. That's the night doctor. And the night doctor is supposed to also come to work at what time? 8 o'clock in the morning. Decide to come at what? 10. Meanwhile, I know the man, you collect salary. Me and you will go and take our salary. Some of us are doing the same thing that we are talking about here. What time do you go to work? That time we do swapping of time. They prepare a duty roster and you decide to swap. Meanwhile, the judge knows why he decided to put an experienced person and a less experienced person together. But we will swap time. Sometimes you're even at a very high level, or you swap time with somebody who is very junior. Doesn't make sense. But your comfort is what you're thinking about. You don't think about the work. A staff nurse, you're a PNO, or senior nurse, you go and swap time with that person. The duty roster is only made in such a way that anytime there's a problem, somebody with a certain level of intelligence, a certain level of competence, a certain level of, to solve the problem. Is that not what we do? Yeah. I don't wonder on Saturday you are calling me unnecessarily. No, I put Kofi Mensah there because I know Kofi Mensah has a first degree in nursing, or has a master's, or has worked over 15 years. I'll put him with what? A staff nurse. No matter what, when issues come, even if they want a death set, he will know what to do. But you swap the time and leave two novices there. Somebody comes and small English, and then they're confused. The person wants something small in the ward, and they are hot, taking here and there. By the time you come back, a mess has happened. Some of the issues you don't need, it's not anything big issue, just you need somebody with a lot of confidence in the ward. When they shout you, so, oh, please, take it easy. This is how we do it here. And that's all, matter close. But they shout at your new nurses and they start panicking. Then the person says, oh, this is a weak point. Let me push and push more. Let me push and push more. So when we make duty rules, don't allow people to mess it up. Me in particular, when I do my duty rules and you do it, I will fight you. So please, let's do that. Then the illegal ops, kusum. We call it kusum ops. Let's take note. Encourage your staff to tell you that they're going on kusum ops so that you know that the place is secured. Or you rather give them the kusum up so that you know that the place is what? Secured. Are we together? Don't let them steal at your back. Let them steal at your front. Or you help them to steal. So that when trouble comes, you can take it wholeheartedly. So you give them the kusum up when you know very well that the place, your back is covered. But sometimes they do these things and when trouble comes, then we'll go and tell the management, and management will be surprised that we've allowed all these things to happen. So that was what happened at my general hospital, and that is not a healthy one. The fourth case was between Elizabeth Var and Leicester Hospital. Yeah, I think this one to you, some of you have some information about this. This is a woman who was treating infertility at a private hospital. This hospital is in Accra, very expensive. If you go there, a lab test alone will throw your pocket somewhere. It's very expensive. So this woman was attending their hospital, then along the line, when he was about to deliver, he delivered and the baby died. He stated here, he said what? Sorry. Stillbirth. No, I think this is not the one. I'm rather going back. Okay, so it's there. The baby, he delivered and the baby was stillborn. That means he didn't even come out alive. You understand that? Then this woman wanted the medical records at the hospital. I don't know why he wanted that. Maybe he wanted to also cause trouble. The hospital decided they won't give it. So she decided to also take the case to court. The court ruled that yes, the person is entitled to records. Yeah. The documents that you have for the patient is supposed to know. Patient's charter, sometimes we don't respect it. Write the information. They're supposed to know even what is wrong with them. But when they come and they ask you, oh, doctor, what is wrong with me? Or nurse, mommy, nurse, what is wrong with me? We're too known to do. Is that what we do in the hospitals? Because of the way we react to them, then they fear to even ask us questions. But they're supposed to know, oh, please, it's typhoid. They can ask you a further question. What causes typhoid? The food you eat, maybe it was dirty. You mix it with somebody's feces. That is why. The water you took. So they refused to give this woman her medical record because they knew something was wrong. Sometimes if you go on their side, things can get better. But if you're too defensive or too evasive, they are coming and you are running away. Just embrace them and say, oh, please, we're sorry this happened, but this and this and this was what happened. And that's all. The matter might die there. But if you are trying to run away or trying to play smart, because this thing was in the news, plenty talk in Ghana here about this case. Finally, the court ruled against the hospital. So let's take note. The patient charter is very, very important. When patients come to our hospital, please let them feel free and feel that they are in a very conducive environment. But sometimes we shout at them too much. Little information we're supposed to give them won't tell them anything. You are giving the patient a suppository. The holes are two. Where is he going to put it? Tell the person clearly where to insert it. But sometimes just so we don't give enough information. Please, let's take note and do the right things. Some people have gone to swallow the chlorphenic suppository before because they were not giving enough. They were not giving enough information. Or certain things that were not supposed to be given into the top hole, they put inside the what? The lower one. And that doesn't help. It will not be absorbed, it will not work at the other side. So please, I hope you understand what I'm talking about. Yes. The last case was Daku and Kolebu Teaching Hospital. This is a very interesting case. A young man went to Kolebu with a leg. Okay, let me take it so that we can all follow. A young man male reported for treatment at the Kolebu with a history of pain in his right knee, which on assessment was diagnosed as torn patellar ligament. He was requested to sign a consent form to allow surgical repair of that ligament. Instead of the right knee being operated upon, the surgeon operated on what? The left knee of the patient. The hospital refused, look at the sad part, the hospital refused to further attend to the patient as a protest over a medical negligence suit the patient had instituted against them. He was supposed to operate on my left knee, isn't it? And they did it on the right. Then afterwards, he was supposed to go for physiotherapy and medical review. The hospital said, no, because you've sued us, we won't treat you. Yeah, that's what the story says. That is what the story says. Because you have taken us to court, then don't come to our hospital again. Meanwhile, in the first place, you caused a problem. You understand? Yeah, so sometimes these things do happen. So they also took the case to court, and the court said no. Even for operating on the wrong leg, no problem. Because the person signed a consent form, and on the consent form it says what? When you go inside and see other issues, handle. Is that what is on the consent form? Yeah, it's there. So here the law was on their side. However, for refusing to treat him, or give him the physiotherapy and even follow up medical care that you refuse, we will take you on for that. That is what? Negligence. And that is wrong. You can't do that. You create a problem and then you abandon the patient halfway to his or her fate. You can't practice medicine this way. So these are some of the issues we do. And this, the typical behavior of health workers, we are only blacklisting people. When a patient comes to our hospital and maybe does something small, so bed 5, the man there with pneumonia will hand over negative information to the people who are coming in the afternoon. And when they come, the same thing, the whole shift, they won't come and even check your temperature. Your BP will not be checked. Or when they come to check, the attitude they will put there, you say, no, there's something wrong. The following day, the man is asking for what? A discharge. Why? The information are going wrong. Or when the wife comes to visit, the way the wife will also come and show attitude, then they'll say, oh, the wife, you're not correct. Or the husband is this. And once you blacklist you in Ghana, oh, forget it. That hospital, you will never have peace. Is that not what we do? This is I'm talking about. They are practical in our place. It's not theory. It happens in a hospital. Sometimes for all you know, the person doesn't know. He wants to just know, or he wants to know something. You want to satisfy certain curiosities. But once you blacklist the person, forget it. You will never have peace in your hospital, in the place. There was also a story about armed robbers who they went to the bungalows of nurses and doctors and robbed them. Then it wasn't long, after a week, armed robbers were brought to the same hospital. For treatment, can you imagine? Today we have gotten you. So we put out the same attitude. So, oh, we'll suture you with a what? Local anesthesia. We won't give the Xyloquine that we're supposed to give so that you're not feel pain. And when they were talking like that, somebody recorded it. And they actually sutured the arm robber without the Xyloquine so that he will endure the pain. Do you understand? So the person took the case to court and he won. It's against the person's right. No matter what. Armed robbers, when they're brought to our hospital, do we handle them anyhow? They're human beings, they have human rights. Even though they have caused harm to somebody else. That is a law for us. We can't change it. No matter how much the provocation, we're not supposed to what? Slap back or pay back people in their own coin. Do your professional work. You suture the person without giving anesthesia. Is that part of the standards? Is that what we're supposed to do? No. So once you do that, the cost will go against you. So challenges in maintaining professional standards. Sometimes resource constraints. You go to a hospital and sometimes even basic gloves, the nurses are not having it. The lights are not working. They have to use their mobile phones to set lines. For deliveries, you have to use torchlight or mobile phone to look into places that are supposed to be right for you to suture and see that all the veins and arteries are what? Locked before the person goes home. If you don't lock them or you don't tie them or it goes home, bleeding can come in. By the time the woman even gets to the hospital, he's in shock. So those things are the burnout and workload on our staff. A lot of our people are leaving, and the few that are left behind, there's so much work on them. Rapid technological changes. So many things are happening. The other day I was watching this in a theater, table theater. Somebody has a remote standing somewhere and just press and the table will come up. Press and the table will turn anywhere you want it to go. I've even seen a remote bedpan. That's how we are going. But here we've even stopped serving bedpan. The normal manual one we are not even serving. To talk of a remote one. So a lot of things are happening. There are times we are faced with ethical dilemmas in our wars. There's a lot of congestion. Dialysis machines are not many, there are only 4 or 2. So who goes and who doesn't go? Whom are you going to attend to and whom are you not going to attend to? Fertility, infertility issues and other things. Sometimes there are a lot of troubles in our hands, or we don't even know what to do. Strategies to overcome them. We need to invest in training and training of more staff and education, supportive leadership and organizational culture. We need to get systems working. We need to collaborate and share best practices. We need to provide the needed supplies for our staff to work. I think I'll jump this. Do I still have time? I'll jump this one. These are the role of these bodies is also important. They're supposed to come around. Nurses and midwives, they're supposed to come around and monitor what we are doing. Do they do it? Once in a while. But when they come, please let's ask them questions because they set the standards. Yeah, they set the standards, so they are supposed to come around. Actually, you know about these people. They can come and close down your hospital anytime. HEFRA, they're supposed to come around. The standards authority, the food we eat. There are so many fake things in the market. That means these authorities are not working. They are not going by the standards. People advertise all manner of things and say they are medications. If you enter the metro mass from Cape Coast to Accra, or the one going to Kumasi, you are going to meet about 3 doctors in a car without license. So all of them, they don't have license. They will talk to you until your ears are blasting. And the medication they will give you, you can treat all your diseases. The only thing you cannot do, you cannot give you money, but all other diseases that you have, forget it. Those are medications can treat them. And that is wrong. We don't run a country like that. The healthcare should be what? Closely monitored and controlled. We shouldn't allow things to be happening anyhow. The way forward. So emerging trends and innovation. Reverend was talking about these things. Robots and other things. These days, we have robots that can do 7 medications and do all manner of things. Lifting patients. These days, you don't even need your energy to do it. Machines are there that can lift patients. I've seen some before. There's even one in my hospital. Only that the way you say, you need one. Don't worry, tell your medical he'll buy some for you. There's even one that can pick you and from the floor to your bed and help to do so many things. Things have changed, so at least we can get better than what we have now. There's also something we call telemedicine. Telemedicine, so that you don't have to travel all the way to Winneba, all the way to Accra. You sit here, your information is sent there, and they give you back your feedback, and medication are brought to your house. That is fine. So in conclusion, we will say technical standards have improved, but social standards have what? Fallen. There are a lot of new information out there for us to improve on our technical skills. But our social skills are going down. What are the social skills? The social skills are D1, the WhatsApp, mobile phone, TikTok. You go to any hospital, the first person you meet will be having a mobile phone. And sitting down, just very keen on a mobile phone. He's not looking at anything medical. They're looking at wedding pictures, dresses, Chatawele and co. Those, I don't know, celebrities. Those are the things they're always watching. They're not discussing anatomy and physiology. They're not talking about medical condition. They're not discussing new trends in hypertension. No. Unnecessary things that they are doing. So that is taking a lot of our attention. And the public, they're not happy with these things. Let me stress here. The people who serve, they're not happy with the way we handle mobile phones in our workplace. They're not happy. They're not happy. Please, when we go, let's talk to those who work under us, our direct reports. And sometimes leadership by example. If you the boss, you come to work and you're busy on phone, so many calls in the morning. Your people who are working under you think that it's right to do those things. So please, let's take note of those things. Somebody asks for a direction. The way you look at the person from head to toe, without talking, the person will not even ask the second question. Please, where is your washroom? And look at the person. There. Why? You have problems in your house, you carry it to the work side. Everybody has a problem, isn't it? The money is all catching for all of us. But when you get to the work side, please relax, take it easy. Smile at people, give them good service. When you go home, you talk about your financial issues in the house with your husband. But we go to the work site and there are so many things that are occupying us. There was a study that was done by these people. And funny enough, they said nurses spend more time on dressing. When they get to the work site, they spend more time to polish up than the time they spend on what? Taking care of the patient. Isn't it true? Oh, please, if you argue, go and look for this study. Go and look for it. It was even done in Central Region. I won't mention the hospital. Go and look for it. I will spend all the time polishing instead of taking care of them. That is what they said. They interviewed our clients, and that's what our clients said. And of late, our nurses wear what? Very tight and short dresses. Very tight and short dresses. Is it part of the standards? Is it professional? Somebody said you have to look smart. But you can look smart without exposing anything. Is it not okay? Yeah. My sister sitting here is looking smart, but there's nothing exposed. She can bend down here and pick so many things and I don't see anything. For some people, if without bending, my BP is already going up. You are not even bending down, my BP is already going up. Why are you causing trouble? So please, let's be smart, but proper smartness, not the other side. Okay? Let's do those things. Our work attitude. A lot of people are lazy these days. They are not committed to the work. When they come, they are busy selling their things in the world. Oh, I'm lying. Yeah. People are lazy. They don't want to work. They are not committed to the work. Very few people are committed. The majority are busy doing marketing. Punctuality. Sorry. Punctuality to work. We don't come to work on time. The afternoon nurse will come at 2 o'clock. So the 2 o'clock medication will be given at what time? 3. It could be your mother that 7 to 2 o'clock medication at 3 or 4 o'clock. When we do that, we're not helping anybody. We are punishing our own people. We need to come to work early and give medications on time. We're supposed to treat people with respect. I've mentioned that. We're supposed to be honest and apologize when we are wrong. One thing about health workers is that we are very, I don't want to use the word proud, but I don't know what to say. But we don't accept our fault. That's one thing about us. When even we are wrong, just so, please, I'm sorry this happened. I'm sorry this happened. Or sometimes we are even wrong in the first place. There are certain things, it doesn't need technical, it's common sense. Do you understand? The other day in my hospital, around 1 a.m., I heard some noise at the emergency. Then I went there, what was the problem? People have brought a dead body to the hospital, and they wanted some information from them. The people were not giving, so they decided to video them or whatever it is. If you video me, do you think I'll take it lightly? No, I won't take it. What you needed to tell them is that, oh, once they've even brought a dead body, you don't even know what happened, the person died. That they were working at the construction site, and the person collapsed and died in the night. So as they're bringing, the psychology is different, though. There are two things. Either you would think that they are the people who even killed the guy. So when they come, the first thing to do is to be on their side. Oh, please, sorry for the loss. Listen, the way it is, we have to take it to the police station. If you have to go and report to the police people, and they will find out, we have to even do post-mortem so that we will be safe and also be safe. And once you talk this way, they will be free to give you information. But if it's everything takashia, it will not work. So they were making a lot of noise. When I went there, I got there, I just apologized, please, sorry for whatever happened. What is the issue? It's one of your people. They started shouting and said, oh, don't worry, I'll talk to them. Then I went in there and asked my nurse, what's the problem? They started talking, and one of them told me that I should come inside. That means I knew there was something wrong. Why are you asking me to come inside? If you are right, let's say they were all here. So once they said I should come inside, that means there's negative. I went and listened to him anyway, and I came out. Still apologized to the people again. I said, oh, please, can I have your telephone numbers? They gave them to me. They gave them their names. I told them, you go to UCC police station and report. Tomorrow, it's already 1 o'clock. Tomorrow morning, you come and you continue the process. And that's all the problem that we wanted. Because they said they wanted to beat my nurse because he has videoed them. He will have big cameras there. Without even you videoing, the cameras that we have already are working. Even up to the car park, the car they were having, it will capture them. So sometimes the issues are not, it's common sense and how to approach people, tactical. That's all. And they will cooperate. So everything that, no. Sometimes you need to go slowly and you get there. So thank you very much, and God bless all of us.